Hi, and welcome. My name is Dr. Robin Evans, and I'm a plastic and reconstructive surgeon working at Ventura County Medical Center. Today, I'd like to chat a bit about the steps of practicing evidence-based surgery. This presentation is really based on this particular book. It's a fantastic book put out by Achilles Toma out of McMaster University in Hamilton, Canada. I can't say enough good things about this book. The book itself really does cover everything that you need to know to have a foundation in evidence-based surgery and the application of evidence-based principles to your practice. So this is a great book, and this presentation is based on knowledge obtained from this book. So ultimately, what we're trying to answer is this question. What is it that distinguishes opinion from a justified belief? How do we know if something is true or not in our practice? Why do we do what we do, and how do we make recommendations to patients based on that knowledge? Well, really, this goes back to an understanding of what knowledge is itself. And epistemology is really one of the four main foundational principles of philosophy. Along with ethics, logic, and metaphysics, epistemology is the study of the nature of knowledge and of belief. Really, we really try to understand what is truth, what is belief, and what is justification. Those are the three ways that we can know. This goes right back to the beginning of Western medicine. So Hippocrates was thought to inspire the creation of 60 medical works, which became really the first medical textbook. These 60 medical works became known as the Hippocratic Corpus, and it was the first documented way to look at natural mechanisms in the context of medicine. So instead of using religious or spiritual principles, these actually began to use observation to create principles, which then became the foundation of Western medicine. Now, interestingly, the way that knowledge was transmitted was through a teacher or a mentor. So knowledge was passed from teacher to student, not dissimilar to how it is today. However, the important thing to know is that these two ways of knowing, by observing phenomena to create principles and by utilizing expert opinion, at one point became to start to be at odds at one another. So this is when, really over the next hundreds and hundreds of years, we began seeing the foundation of clinical trials, the development and utilization of statistics. And then in the 1990s, we have a new phrase that came into being, and that is evidence-based medicine. And Gordon Guyatt and David Sackett in the early 1990s, again out of McMaster University, coined this phrase. And this was really a way to systematize the epistemology of medical knowledge and to begin to shine a light on the importance of acquiring evidence in your medical decision making. It's not expert opinion. It's not who you know. It's how you know it. So how do we actually make decisions in surgery? Well, this surgery is comprised of a number of factors that we actually have to balance within our surgical expertise. These include things like the clinical state, the setting, and the circumstance of the patient. It has also to do with what the patient wants. What's their preference and choice? How does it fit into their life? It also takes into account healthcare resources. So if you work in a rural setting, you may not have access to a Da Vinci surgical robot, even if it has better outcomes. And you have to account for the research evidence. How do we take the literature and the articles that have been written about a particular topic and translate that into something that we recommend for a patient? And that's really the purpose of this talk today. So what Dr. Toma has done is he's really distilled it down into a number of steps. And these steps are very important to follow so that you have a guide to actually be able to make clinical decisions and begin to practice in a more evidence-based fashion. The first of the steps is to really construct a relevant, answerable question. I'm going to say that again, a relevant, answerable question from a clinical scenario. And the way to do that, of course, is with a mnemonic P-code. And that is, of course, summarizing a question that has these particular elements to it. So you want to have a population that you've actually stated and defined. You want to talk about what is the intervention that you're applying to that patient population. What are you comparing that intervention to? What is the specific outcome that you want to see by that comparison, and over how long? What's the time horizon? So here's an example. So in a locally treated trauma patient, does the use of whole blood as compared to component blood products actually improve mortality in the first 24 hours? So the population is our locally treated trauma patients. Our intervention is the use of whole blood. We compare it to our component blood products, and our outcome is mortality within the time frame of the first 24 hours. Another example would be in an acute wound, so defined as a wound less than 6 weeks old, patients treated at Ventura County Medical Center. Does the use of hypochlorous acid or VOSH solution compared to a silver-based dressing improve the time to healing? So this is, again, we look at the very specific population that have a very particular problem. We see the intervention, which is in this case VOSH. We compare it to a silver-based dressing, and what we really want to know is it actually improving the time to healing in common patients? The second step is to plan and carry out a search of the literature for the best external evidence. So what has been done already? Now, the great thing about starting with your well-defined answerable research question is you can use that P-code formulation as the generation of your keywords. So you can actually use those keywords. And now a great point here is, of course, you'd want to use the best sources of evidence first. And as we know, the highest level of evidence is in fact meta-reviews and meta-analyses. So that's the Cochrane reviews. Filtered databases are useful to examine first. Only secondarily should one use an unfiltered database like PubMed. Caution should be given to those who use Google Scholar, as the algorithm and the search algorithm is not transparent. So unlike PubMed, which is an unfiltered database, Google Scholar does manipulate the search results, and Google is not transparent about how that actually happens. So just user beware. Google Scholar, although powerful, may give you strange results. So you've done this, you've made a question, you've done a search. Now you actually need to appraise the literature. Critically look at the literature for two things: for validity and for applicability. So first, we want to say, well, let's just summarize what is validity? Well, validity can be summarized as saying, are you actually measuring what you set out to measure? Whereas reliability is, can you repeat that measurement and get the same result? Can you repeat it again and again and get the same result? So this is a very common diagram as a bullseye and someone shooting arrows or throwing darts. And here you can see on the left, the results here are reliable, but they're not on target. You're in the same area all the time. That's contrasted with something that's valid, but it's not reliable. It's all over the board. You can have, of course, neither reliable nor valid, but what you're really looking for is a measurement that is both valid, it hits the bullseye, and it's reliable, it hits it every time. So here we can see that what we want to know is our research both valid and reliable? So I just wanted to briefly review this. This is important when appraising the statistical literature, and although this is quite basic, I think it's important to bring up because it is important to understand, of course, that we use statistics. We don't allow them to use us, and we want to make sure that our statistical knowledge is really guiding us to the truth, and that it's not truth in and of itself. So what is a p-value? Well, a p-value is the probability that an observed difference could happen by random chance. So that means that a really small p-value suggests that an extreme observed outcome is very unlikely under the null hypothesis. So of course we test the null hypothesis. In science, we have a hypothesis. We want to know something to be true. We have a guess on how the world works. And the null hypothesis is that that is not true. And then we go about trying to prove or disprove the null hypothesis in order to understand if our theory holds weight or truth or not. It's important to note that just because you have statistical significance, that doesn't mean it's true. It just means that you have an observed difference that is unlikely to have happened by random chance. That doesn't mean that it didn't happen by random chance, nor does it mean that it's clinically relevant for your particular circumstance. Of course, there has been a movement within the medical literature to really look at the 0.05 threshold and ensure it's appropriate for every clinical situation. When we get into really big data, actually what happens is if you have so much data, you can actually have statistically significant differences that are in fact clinically irrelevant. So as we enter into this big data space, especially with things like genetic testing, we have to really be careful about using this p less than 0.05 threshold, and that perhaps a much more stringent threshold would be more appropriate. So again, you have to use your data to inform you, and really it goes back to that slide with using your clinical and surgical expertise. So step 4, you want to apply the evidence to your clinical practice. And of course, this sounds easy, but it's probably one of the more difficult parts of all of these steps to an evidence-based surgical practice. The question is, are the patients in the literature actually like yours? So for instance, if you read a paper about a particular procedure performed in an adult and you wanted to apply it to a pediatric population, it may or may not translate. Of course, the other component to this is, do you actually have the resources to be able to do it in the way that was described within the literature itself? So step 5 is something that's often overlooked, but is probably one of the most important components of an evidence-based surgical practice is, do you regularly evaluate your effectiveness and your efficiency? And here's a number of questions that you can ask yourself. Are you asking answerable questions? Are you effectively navigating the literature? Can you critically appraise it? And are you effectively integrating your findings into practice? These questions and these steps are very important because what they do is they allow us to begin to understand our own bias. Of course, we all have bias. We all come from a certain set of experiences and we all look towards certain outcomes. The question is, are we doing this in a systematic way that we are constantly improving? And what I've found to be incredibly helpful, of course, is to have a mentor, to have someone to be able to call you out, to be able to make suggestions, and to be able to really help you to do these steps in a systematic way so that you can become a more effective practitioner. Finally, I just wanted to briefly mention here at the end that when we have a hypothesis in science, the accumulation of data eventually leads to two different components. And over our medical practice, the same thing happens, is that we begin to develop laws that actually can predict what's going to happen. So you see a patient that you've seen before, you have published on this topic, you believe that this particular set of clinical indicators or assessments will lead to this particular outcome, and you make a decision on that. You are developing a law, but that's different than a theory. A theory actually answers the question why, and the theory is really the logical explanation of why things actually happen the way they do. And oftentimes you need a lot more data to really understand the why as opposed to the what. So I just wanted to leave you with that thought that as we navigate our surgical practices and as we take care of patients the best we know how, it's important that we're doing it in a transparent and as an unbiased way as we possibly can. Hopefully this has helped you to get excited about evidence-based surgery and to apply it more readily to your practice. Thank you so much.